Happy holidays, and thanks for listening to the American Hospital Association's Advancing Health podcast. We hope you have found it useful and informative. Advancing Health returns with stimulating new episodes in 2024. In the meantime, enjoy these highlights from our treasure trove of podcast episodes that have released throughout the year. And we hope you and your family have a safe and wonderful holiday and a happy new year. The push for increased diversity and inclusion on boards of governance for hospitals and health systems is gaining momentum these days. A 2023 AHA National Survey found that boards are paying increased attention to bringing diverse viewpoints and life experiences to their membership. This includes diversity of professional backgrounds. In this podcast, one trailblazing hospital trustee says what more boards could really benefit from is the perspective of nurses. Welcome to Advancing Health, a podcast from the American Hospital Association. I'm Tom Hederle with AHA Communications. Ellen Brisdois was recruited as a hospital trustee 45 years ago, the first nurse trustee for a hospital in the greater Cleveland area. Her own experience has shown her that more hospital boards should have nurses as members, people who understand firsthand the complexity of patient care and issues of quality and safety. In today's podcast, hosted by Sue Ellen Wagner, Vice President of Trustee Services at AHA, Brisdois discusses her mission of bringing more nurses into board positions, all of the benefits they bring, and what boards should be focusing on now.
Hi, this is Sue Ellen Wagner, Vice President of Trustee Services with the American Hospital Association. I want to introduce Ellen Brisdois, trustee of the Cleveland Clinic, who's here with me today. Thank you, Ellen, for being here with me. Ellen, in addition to being a board member, has a nursing background. Ellen, can you talk to us a little bit about your background?
Yes. I have been very fortunate to have a nursing background and also be a hospital trustee. My clinical work and my academic work early on in my career were in psychiatry, now behavioral health, and public health. And I was recruited to be a hospital trustee 45 years ago.
Wow.
I was the very first nurse trustee for a hospital in the greater Cleveland area. And it was a very exciting time. To be a trustee, I was really unaware that this was so unusual. And as I grew in my role of being a hospital trustee, I came to understand the value of what I was doing in terms of my own work in enhancing and promoting my hospital and all the good things that it did, but also my relationships with other trustees. At that time, that none of them had any kind of healthcare background, mostly all male, and also from the local community, well-meaning. I found I was acting as a translator and helping them to understand what it was we were talking about. Because they were all male at the time, they often were hesitant to ask questions, and I came to understand this, and people would approach me after the meetings for clarification. Eventually, I would just ask right in the meeting, "That's another acronym. What does that mean? I can't remember." And then after a while, everybody got comfortable with that. Quality and safety issues were there from the very beginning. Fast forward, I've now served in hospitals that are merged into large systems and have been very privileged to be part of the AHA effort to involve trustees in a more meaningful and ongoing way, which is, I think, over my career, 45 years as a trustee, is new. And I think it's coming into its own. I think trustees bring a huge insight to the very hardworking staff of AHA at all levels, local hospital associations too. They have relationships they can use effectively to advance and also educate all kinds of people that need to understand how hospitals work and why there are, over 45 years, always continuing crises. Although in my lifetime doing this, I do think we are at a very, very critical, very, very uncomfortable place. And the role of the trustee to be helpful to the executive staff and to their communities, I don't think has ever been more important. One of the things that I've grown to understand is the need for perhaps more trustees that are nurses. And about 10 or 15 years ago, I was involved with the Robert Wood Johnson Foundation, series of investments trying to deal with the nursing shortage, advance the public's understanding of the role of the nurse, but also to move more nurses onto the boards of trustees. This has become a passion for me.
That's great.
It has been rewarding and now I'm seeing more interest in this than I have ever. It was always just a hard sell. The other CEOs or the trustees would say, we have, the chief nursing officer. I'd say, no. I'm talking about an independent, outside expert on the field of nursing that will bring you more vision and understanding about the complexities of patient care, about the huge nursing workforce, and all these things are now coming to the fore, especially the issues of quality and safety and nursing practice. So I'm hoping that by my activities with AHA and the people that I work with that are the staff and other trustees that are starting to think this way, that I can advance that agenda of getting more nurses on boards.
I think you are. I just want to mention you are on the Committee on Governance with
Yes.
AHA, and you've contributed a lot of valuable insight on workforce challenges to that group. So I do think you're increasing awareness. To talk a little bit about, so with all the workforce challenges that our hospitals and health systems are facing, what should boards be focusing on with those workforce challenges? And if you could also address as part of that discussion the value that a nurse will bring and how can folks find a nurse, that independent nurse?
To be on a board.
Yeah.
Well, let's talk about that as long as we've been talking about nurses on
Sure.
boards. Any hospital that's interested in this can reach me through Sue Ellen to talk about it, because sometimes people have to get comfortable with the idea, and I'm always
Right.
available to do that. But there is a terrific organization called Nurses on Boards, and go online, nursesonboards.com, and there's a whole structure in place to be either a partner with Nurses on Boards to get more information on this, or to ask their help in terms of finding an outside nurse that could be a trustee for their organization. And yesterday I was in a trustee meeting here at the AHA Leadership Summit in Seattle, and one of the gentlemen who was presenting offered himself as an example and said, I live in Chicago, but I'm the chairman of the board of a hospital in Bend, Oregon. So even if you're a remote hospital or you're from a geographic area in which you're having a difficulty finding someone, this can be accomplished. And Nurses on Board and also Sue Ellen Wagner at AHA can help a hospital if they have interest in doing this. The value is, again, in terms of understanding all the dimensions of the nursing shortage. I often find that people are just panicked over what's immediately in front of them, and I sure don't blame them, because half of my heart is as a trustee, as a nurse also. I see the stress. I see what COVID did to the nurses. I see the expense of dealing with that. And nurses are now being paid for the value they are. But looking at the shortage, there's more dimensions to it than just looking at how many people you need to recruit or your turnover rate. All those things are very important. But I often think that the hospital side focuses on that and has less focus on the education side. And I'm seeing a shift in that too, a lot more interest on a sustained level in terms of the pipeline. How do we compete with perceived cool jobs when young people see that nowadays? How do
Right.
we get them in the pipeline? How do we get populations that have never been attracted to a profession or nursing, get them prepared? You have to start in practically late primary school, early junior high, to recruit and get them into science-based thinking and curriculum. And there has to be a cool factor. And we have so many things about healthcare and hospitals that are so cool. All this superhero stuff, we have it. We just
technology.
the technology, all these things, we have it all. We just don't package it. We don't sell it. And hospitals really going to have to, and I start to see them putting in pipelines that are addressing the education part of being a nurse and the recruitment part, but also all these other dimensions of the cool factor. We still only have 12% of nurses that are male. We have a huge job to do with those. We've got all kinds of underserved populations. We only have, I think it's now 14% of nurses that are African American. We have less than that Asian Pacific. And the worst are our tribal nation nurses. And we have so many places to get people into nursing, but it has to be a sustained, evidence-based approach. So that's one thing. But the other side of the hospitals taking more interest is in the nursing education programs that produce or register nurses. And they really, I think most hospitals do not know the ins and outs of how colleges and universities educate nurses and how to support those systems or how to intervene to expand the capacity of schools of nursing. We can look at new models of care on the practice side, on the delivery side, but if we don't pay additional intense attention to the schools and colleges of nursing in this country, we will not be helping ourselves. So,
Well, and thank you, because you've really outlined what boards should be paying attention to
Yes.
and looking at that strategy for the workforce going forward.
Yes.
Getting back to the board's role in terms of governance and recruiting board members who have a nursing clinical background, I'm thinking you'll agree that that should be part of a governance matrix, right, of skills and
Absolutely.
competencies that folks should be looking for.
Absolutely. AHA did one of the most intense and expansive surveys on what boards of trustees in America need that I've ever seen in my career. And as I say, I've been a hospital trustee for 45 years. In my early career, I created an institute for trustees in Cleveland because I saw such a huge need. And now they are starting to look at people having two, and help me here, Sue
Okay,
Ellen.
sure.
One thing is they're looking for health literacy in new recruits of trustees to a hospital board. Well, automatically a nurse has
that.
health
Right.
literacy. The second thing they're looking for is expertise in mission critical areas. Well, what's more mission critical for a hospital than a sufficient number of well-educated, healthy, vibrant, joyful nurses taking care of patients, not only in hospitals, but in all ambulatory settings.
Sure.
And so, to me, the case for having a nurse trustee is so powerful. I yesterday spoke briefly at a meeting, and I said to the other people in the room, even if you never see me again, you'll be thankful that I pushed you on this to think about
Yes.
this.
Yep.
Because go back to your home base, go back to your health facility, and think about what I'm saying. It's very, very important. And it will help the other trustees as well.
Yes. Well, and also adding that skill set to your metrics if you don't have
Yes.
it already.
Yeah.
Just one last thing in closing. AHA put out a 2022 governance survey report identifying
Yes.
all of the trends. I think
Yes.
you referenced that.
Yes, excellent.
One of the trends that's not so great is pointing out that boards do not have, many of the survey respondents, the 18% that we got, do not have that nursing skill set on their boards. So that's one of the areas that we need to work on with our hospitals and health systems to help recruit for that key clinical eye and expertise.
That's right. And also to piggyback on that same survey, it showed that, and I'm guilty as charged, there's a lot of us that are old and need to exit stage left off these boards at some point. And looking at adding younger trustees, there's a lot of young nurses that are leaders and would be amazing and
To be on boards,
Yes,
yeah.
and they're looking for diversity. Within nursing, we do have diversity. We've got more diversity than many of the other health professions. So I think it's a double, triple win
I
to
do
add
too.
a nurse
I do
trustee
too.
to your board.
Well, Ellen, thank you for joining me today. Appreciate your words of wisdom, and hopefully more folks will pay attention to adding nurses on their boards.
Well, I thank you for making an arrangement to have me interviewed about this with you, Sue Ellen, and I appreciate AHA's continuing and expanding focus on the nursing profession and the nursing workforce. Thank you.